Ever wondered why the little soldier sometimes refuses to stand to attention? Today, we're diving into a topic that's often hushed up, but far more common than you might think: erectile dysfunction. It's a condition that doesn't discriminate, affecting men of all ages, from 20 to 80 and beyond. But remember, the little soldier's refusal to stand up is not always a sign of a major health problem, but it can be a symptom of something more serious. So what exactly is erectile dysfunction and why does it occur? Erectile dysfunction, commonly referred to as ED, is a condition where a man has difficulty achieving or maintaining an erection that's firm enough for sexual intercourse. It's not uncommon for men to experience this on occasion, but when it happens frequently, it may be a sign of an underlying health issue that needs attention. The process of achieving an erection is a complex one. It involves the brain, hormones, emotions, nerves, muscles, and blood vessels. If there's a problem with any of these components, it can lead to erectile dysfunction. Now, let's talk about the physical factors. These can include heart disease, high cholesterol, high blood pressure, diabetes, obesity, and even certain prescription medications. All of these can affect blood flow to the penis, which is crucial for an erection. On the other hand, psychological factors can be just as influential. Stress and mental health concerns can cause or exacerbate erectile dysfunction. Anything from work stress, relationship problems, to serious conditions like depression and anxiety can lead to difficulties with erections. Substance use, such as excessive alcohol or illicit drugs, can also play a role. While they might seem like they enhance the mood, they can actually impair sexual function. And of course, we cannot forget about the role of age. While it's true that erectile dysfunction becomes more common as men get older, it's not an inevitable part of aging. Men of all ages can and do experience ED. Finally, it's vital to understand that while erectile dysfunction can be a sensitive topic for many men, it's not something to be embarrassed about. It's a medical condition, just like any other, and it's treatable in most cases. Erectile dysfunction is not a one-size-fits-all problem. It can affect any man, regardless of his age, and its causes are as varied as the men it affects. So it's important to speak openly with a healthcare provider about any issues you're experiencing. They can help find the cause and appropriate treatment options to manage the condition effectively. Now let's delve into how age plays a role in erectile dysfunction. When we talk about erectile dysfunction, or ED, it's important to remember that it's not exclusively a condition of older men. It can affect men at any age, though its prevalence does increase with age. Let's start with young men, those under 30. While you might think they're immune to ED, that's not the case. In fact, studies suggest that about 1 in 4 men under 30 may experience erectile dysfunction. It's often linked to psychological factors like stress, anxiety, or depression. Moving on to middle-aged men, those between the ages of 30 and 60. This is the group where we see a significant increase in ED prevalence, with about 40% of men experiencing it to some degree. Here, it's often a mix of psychological and physical factors. Stress and anxiety still play a role, but health issues such as high blood pressure, diabetes, or heart disease start to emerge as contributing factors. Now, when we talk about men over 60, the prevalence of ED rises to about 60 to 75%. This is often due to age-related health problems like prostate conditions, diabetes, and cardiovascular disease. However, it's important to note that aging itself is not a direct cause of ED. Rather, it's the health issues that often accompany aging that contribute to it. But remember, age is not the sole determinant of erectile dysfunction. Other factors come into play too. Lifestyle choices such as smoking, excessive alcohol consumption, and lack of physical activity can all contribute to ED. Psychological factors such as depression, anxiety, and relationship issues can also be significant contributors. Age may be a factor in erectile dysfunction, but it's not the only one. Other health issues, lifestyle choices, and psychological factors can also play a role. Erectile dysfunction doesn't just affect the man experiencing it, it can also have a profound impact on his relationships. This is a truth many might find hard to swallow. It's not just a physical issue, it also tugs at the emotional and psychological threads of a man's life, weaving a complex tapestry of challenges that can strain relationships to their breaking point. Let's delve a little deeper into this. Picture this. A man, once brimming with confidence, suddenly finds himself grappling with feelings of inadequacy and embarrassment. His self-esteem takes a hit, and he begins to question his worth as a partner. He might start to avoid intimacy altogether to escape the possibility of failure and the accompanying disappointment. This withdrawal can leave his partner feeling confused, rejected, and hurt. This is where the importance of open communication comes in. If you or your partner is dealing with erectile dysfunction, it's crucial to have those difficult conversations, to bring the issue out into the open. It might be uncomfortable at first, but it's the first step towards understanding and coping with the situation. It's essential to remember that erectile dysfunction is a medical condition, not a reflection of a man's masculinity or worth. Now, consider the partner's perspective. They might feel rejected or believe they are no longer attractive to their partner. They might even blame themselves, wondering if they did something wrong. Here too, open communication is key. It's crucial for the partner to understand that erectile dysfunction is a physical issue, not an emotional one. It's not about them, and it's not about the love or attraction in the relationship. In the end, it all boils down to understanding, patience, and open communication. Erectile dysfunction can be a challenge for any relationship. It can bring about feelings of inadequacy, embarrassment, and even guilt. But remember, it's a medical condition, one that many men face at some point in their lives. And like any other challenge, it can be overcome. Not with silence and avoidance, but with empathy, understanding, and open dialogues. Erectile dysfunction can be a challenge for any relationship, but with understanding, patience, and open communication, it doesn't have to be a deal breaker. Erectile dysfunction is a problem, but it's not an insurmountable one. There are solutions and treatments available. Let's start with lifestyle changes. Eating a healthy diet, maintaining a regular exercise routine, limiting alcohol intake, and quitting smoking can all help improve erectile function. These changes can not only improve your physical health, but also your mental and emotional well-being, potentially reducing anxiety or depression that might be contributing to erectile dysfunction. Next, we have medical treatments. There are numerous medications available that can help with erectile dysfunction, including pills you take orally, injectable medications, and even some that are inserted directly into the urethra. These medications work by increasing blood flow to the penis, making it easier to get and maintain an erection. And then, there are therapies. If the underlying cause of erectile dysfunction is psychological, such as stress, anxiety, or depression, cognitive behavioral therapy or sex therapy could be beneficial. These therapies can help address the mental and emotional aspects of erectile dysfunction, helping you to better understand and manage your condition. In some cases, a doctor might recommend a physical treatment, such as a vacuum pump or a surgical implant. These treatments can help when other methods have not been successful. It's important, however, to understand that what works best will depend on the individual. Everyone is different, and what works for one person might not work for another. That's why it's so critical to seek professional medical advice. Don't self-diagnose or self-medicate. Talk to your doctor about your symptoms, your health history, and any concerns you might have. They can guide you to the right treatment option for your unique situation and help you navigate this journey with confidence and compassion. Remember, erectile dysfunction is a medical condition, and like any medical condition, it deserves professional attention and treatment. Let's take a moment to recap what we've learned about erectile dysfunction. This common condition, often referred to as ED, is characterized by the inability to achieve or maintain an erection suitable for sexual intercourse. It's a medical issue that can affect men at any age, but its prevalence does tend to increase with age. We delved into how age plays a role in erectile dysfunction, understanding that while it's more common in older men, younger men are not immune. It's essential to remember that ED is not an inevitable part of aging, but rather a condition that can be triggered by a variety of physical and psychological factors. We also explored the impact erectile dysfunction can have on relationships. It can lead to stress, decrease in self-confidence, and contribute to relationship problems. Communication, understanding, and patience are key in navigating these challenges. Importantly, we discuss the various solutions and treatments available. These range from lifestyle changes like regular exercise and a healthy diet, to medications and even surgery in some cases. Mental health counseling can also play a crucial role, particularly when psychological factors are contributing to the condition. Erectile dysfunction can be a difficult topic to discuss, but it's important to remember that it's a common issue that many men face. Seeking help and understanding is the first step towards addressing the issue.